whatever the material, it will irritate the pigments which is in the tattoo and make a lot of trouble. So I will choose the area which is like away from the tattoo, so it will be like here. All right? And as we mentioned, that circular sanitization is very important. And also we have to go by the injection of saline. And before I do sterilization, I have to be sure that what is the lot number and what is the expiration date. And here the expiration date will be 11/21, so it will be safe. Also, I do sterilization. We have the syringe. As we mentioned, that the proper size is 25 gauge. So when you look to the back here, we have it is 25 gauge. As I told you, when we open it, not open it far away from the table, not too close to the table. It is like midway to be sure that it is not going to be jumping away. Here we have the plunger and the barrel. We have to repeat this action back and forth many times. And here we have the needle has a safety to be like screwed. So this is more expensive than the one which is just plug and in. Okay, so this is more safety. I will remove the cap, put the cap in sharp container, and I am going to give like half millimeter. Okay, so I take air first and then inject it into the bottle, and after that I flip it. So far I have air inside. Air will push the syringe by itself, as you see. So it is working by itself. Okay, I got more than what I need, so I push back till I get the exact amount. Okay. And by this technique, I minimize the presence of air bubble. If I have very small air bubble here, I will hold the plunger and knock just below the air bubble very gently. It disappears.
What would happen if there were air bubbles and then you proceeded to inject someone?
Okay, this is a very good question. Air bubble, we are afraid from air bubble if we're going into the artery or vein. Of course, we have a precaution that when we go intramuscular or in subcutaneous, we have to do aspiration first to be sure that I am not in a blood vessel. But if by mistake I am in the blood vessel and I inject directly, this air bubble will make like air embolism, and this will be very hard to affect like the brain, the eye, the heart, and so on. So now, after 30 seconds, she is already, the skin is dry. I hold the needle with the bevel up and like this. So I have like bulk here of the fat, as you see, and I adjust the angle to be 45 like this. I release and aspirate 1, 2, 3, 4, 5, no blood. So I inject, and that's it. Okay? As I told you, if we are going to inject something which is heavy, like oily, we have to use bigger size of the gauge, like 23 or 21, and we go slowly. Okay? So we done. As I told you, if you go in the 45 angle and you come out at the 45 angle, you will be like, notice no return of the fluid and no blood. But sometimes we enter 45 but come back bigger or less than 45, so we damage to the tissue and the blood will start to show up. After I'm okay now, I prepare already. I have to recap here for safety. Put it in the sharp container and I apply the bandage here And that's it.
Ta-da.